You can see just with Barney James, someone who's a high-performing athlete who you would never expect to have cardiovascular issues, who suffered from a cardiovascular challenge.
It's kind of crazy to me that healthcare is one of those things that people are like, oh, whoa, why am I spending that money? When like you see someone driving like a very expensive car, but they're very hesitant to invest in their own automobile machine that they're walking around in.
I've known both these young ladies their entire life, both of them from the time they were even thought about existing.
Welcome to the Precision Medicine Made Simple podcast, where we simplify the complex world of precision medicine. We're here to explore how personalized healthcare can empower you to understand and improve your health to live a longer and healthier life. Join us as we break down the latest in medical science into actionable insights. Let's make precision medicine accessible and actionable for everyone. Enjoy the show. Today's episode is sponsored by Biography Health, where healthcare meets personalization. With their DNA-enabled blueprint, Biography Health empowers you with a health plan based on your unique DNA, aiming to prevent disease and extend your life. Take control of your health journey with a plan as unique as you. Visit biographyhealth.com and start your personalized healthcare journey today. As a reminder, this episode is for educational purposes only. This episode is in no way a replacement for professional health advice. Please consult with your professional primary care provider for medical advice. If at any point you feel that a topic discussed on our podcast was misrepresented, or if you have additional insights that could enhance our discussions, we wholeheartedly encourage you to reach out to us. Your feedback is invaluable in helping us improve and in ensuring our content remains both informative and reflective of the latest developments in precision medicine. In this episode, we're joined by two younger guests for our Gen Z special, featuring Eliana Stanford, Dr. Stanford's daughter, and Lexie Horizon, whose parents are fellow doctors and friends of Dr. Stanford, and who recently interned at Biography Health. This unique conversation explores why younger generations should care about and take action towards preventive healthcare. The discussion covers key topics including the importance of whole genome sequencing and its potential impact on personalized healthcare, how precision medicine can benefit mental health treatment, and then the challenges of making preventive care accessible and affordable. You'll be gaining insight into how precision medicine is becoming more relevant to the younger generations and how it could revolutionize healthcare delivery. What's up, everyone? Welcome to the Precision Medicine Made Simple podcast. I'm here with my co-host and face of this podcast, Dr. Stanford, and then we have two very special guests that are coming into this podcast episode for the Gen Z podcast. And that special guest, one of them is Lexie Horizon. Her father, well, actually her parents, not just your father, your parents are great friends with Dr. Stanford, and you have an interest in preventive healthcare. And then also we have the famous Eliana Stanford, which is Dr. Stanford's daughter, coming to the podcast. And today we are going to be talking through just a number of different topics across, why the younger generation should start to care and take action towards preventive healthcare, and then also the conversation with how we can have that with our parents and vice versa. And so we're going to be going through a number of topics there. So welcome, everyone. This is the most spaces that we've had in Zoom room.
It's about time.
I know. Geez. It was long overdue. Before we get started, why don't we just go around the table and give us a quick introduction before we dive into it?
I'm Eliana. I'm Dr. Stanford's daughter. I'm also a neuroscience and computer science double major at Dartmouth College, where I am doing lots of computational neuroscience research and very interested in the preventative healthcare space as well, not only through my dad, but also through kind of the philosophical lenses that I've been exposed to through my coursework here. So I'm very excited to talk about it, and I think it's going to be a really interesting dialogue, so I'm very interested.
Hi, I'm Lexie Horizon. I am going to be a sophomore at Wake Forest University, and I'm a pre-business major with a concentration in healthcare and a Spanish minor with a concentration in business. I was the summer intern at Biography Health this summer, and like Taylor mentioned, both my parents are doctors. I've grown up in the medical space, and realizing through my courses in business and in medicine, I think I've come to realize that healthcare isn't accessible to a lot of people, and especially preventative healthcare. And so I joined Biography Health to kind of learn about how this company is expanding preventative care to everyone.
Yeah, and shout out to you for thinking of this idea too for this podcast episode as well, Lexie, because I remember you. I mean, you just came to me and then Alyssa and started talking about why younger people should start to care about this, and so this episode is because of you. So thank you for that. And then Dr. Stanford, I don't know if you want to give a little bit of an intro, but yeah, I guess you can give an intro to yourself too.
I've known both these young ladies their entire life. Both of them from the time they were even thought about existing. So Lexie's dad and I trained together at UCLA, and we've been close friends and colleagues ever since. He's one of the doctors I respect most in the whole world, as is his wife, Janice, who I met through Arash some years ago. Her and I partnered together in the field of hospital medicine at Cedars-Sinai, and pretty much brought the concept of private practice hospital medicine to Los Angeles. Is only I don't think that's even a exaggeration at all. And we built a group from initially just her and I to numbering something like 30 patients before I left Cedars in 2018.
Wow.
Eliana, of course, I've known her whole life. And what both of the, I think it's kind of an interesting thing when you're the offspring of doctors, especially for Lexie, having two doctors in the house, but both of these women know a lot more about healthcare and doctoring than you would expect the average 19 or 20-year-old to know. And I'm sure that'll come across in this podcast as well. So I'm interested to hear what's on their mind in terms of what the future of medicine is. I think that they've both indicated that they're going to have an interest in healthcare going forward in a career sense. And what we're doing at Biography Health and what we're going to be talking about today will be the cornerstone of medicine 10 or 15 years from now. And that is the idea of using genetics and data analytics to be predictive of future health risk of chronic disease, and steps you can take as soon as possible, sooner the better, at mitigating those risks.
And it isn't very common to have very young folks to be interested in this. I mean, granted, parents are doctors and in the healthcare industry. So I'm curious, just from both of you, like what piqued that curiosity to even dive more into this, and I guess even hop onto this podcast and have this conversation?
For me personally, I've always been a very interdisciplinary learner. So it was never just healthcare for me. It was never just biology for me. It was never just chemistry. It was always like, how does that intersect with philosophy, ethics, art even? And that was really facilitated through my dad, who was always looking about different routes to approaching medicine. Even with his hospital-based practice, he was always that doctor that was an outside-the-box thinker. And I would have people come up to me and tell me that, and I was always very inspired by that. So that really encouraged me to be an analytical thinker, and really through the lens of like healthcare specifically because of him. And then through my studies here in neuroscience and technology, I really got that bug for genes and data and whole genome sequencing and the way that we can manipulate data and have accurate predictions and models for like rare diseases, for cancers that there aren't cures for. So yeah, that's kind of where my interest came from, largely inspired from my dad and just the potential of the industry as a whole.
I think similar to Eliana, I've definitely had personal experiences, but also academic experiences that piqued my interest. Starting on the academic side, I think my bioethics class in college was definitely an eye-opening experience. I had heard about genome sequencing in high school and through my parents, but I never really heard about like the disparity between those who had access to genome sequencing prior to college, and that it's not something accessible to most people until now. And so that was really interesting for me to hear. And as for preventative care goes, in my own family, have had experiences with breast cancer. My second cousin passed away from breast cancer. My aunt was diagnosed with breast cancer, and my mom had a preventative mastectomy. to like in advance, hopefully not having to prevent herself from having breast cancer. And so I think now as I'm getting older, it's even more important for me to have genome sequencing and to be aware of those genes in my family and take proactive measures instead of reactive measures, because that can be the difference between life and death. And I think had my cousin who had passed away known that she had carried this gene, she would have done things differently and had screenings earlier and just taken more preventative care that could have led to her maybe living longer. So I think that personally is an experience that means a lot to me and is the reason that I really believe in preventative care.
Yeah, and you use the term whole genome sequencing, and I guess we've talked about this somewhat on the podcast, but never actually gave like a clear, well, I mean, we've given different definitions of it, but never have specifically said like what is whole genome sequencing. And so, Dr. Stanford, can you break that down as to what whole genome sequencing is and what that looks like then, and also compare it to some of the other, I guess, products that are out there? Because like, does 23andMe do whole genome sequencing? Ancestry.com? Like, what does that term really mean?
So each of us inherits 23 chromosomes from mom. And over those 23 chromosomes, there's 3 billion letters of genetic code. And we inherit 23 chromosomes from our father. And across those 23 chromosomes, there's 3 billion letters. So there's 46 total chromosomes, 23 pairs, 6 billion letters. That and whole genome sequencing, we literally determine what every letter is at every position of all 23 chromosomes from mom and the 23 from dad. There's another technology out there which is much cheaper and faster than doing whole genome sequencing, and that is looking for particular gene variants using a different technology that is used for whole genome sequencing. Sometimes it's called microarray based or chip based. And basically what that does is for 1 million different locations, it will tell you what the likely letter in the code is at that particular location, which then tells you what the particular gene variant is. So Lexie mentioned the cancers that can be inherited, and this is not the one affecting her family, but we've all heard of the breast cancer gene BRCA. And so with BRCA, there's really thousands of different mutations that can occur in there. Some are very dangerous and lethal, and some of them much less so. So in other words, it doesn't change the function of the BRCA gene product much. So with a microarray, they may look for a handful of those variants. In whole genome sequencing, we're going to look at every single letter, and for all 2,000 whatever potential variants there, we could tell you where the patient is for each of those. So whole genome sequencing is much more comprehensive and is really the way to go, I think, at this point, because we're very early in the process of determining the fund of knowledge, so to speak, around the significance of all these gene variants. With whole genome sequencing, you're going to have every single gene variant, whereas the microarray-based testing is just based on what consensus dangerous genes are. So with whole genome sequencing, you can sequence once and analyze many times. With microarray based, you may or may not have all the information you need after doing that microarray based genotyping to accommodate what the knowledge set is, say, 10 years from now. So you would have to repeat the testing. With 23andMe and a lot of direct to consumer type testing, it tends to be this microarray based testing, which can, the advantages of it is it can be quick and informative as to what the current state of knowledge is. What its shortcomings, though, is it is not going to necessarily have all the variants you need to be as predictive as you could possibly be, especially reflecting the fund of knowledge, so to speak, years down the road.
This might be a silly question, but Eliana and Lexie, have any of your friends had whole genome sequencing, or yourselves?
I think I've had my whole genome right? I've had my whole genome right. Cut out that part where I'm unsure. I have had my whole genome sequence. And it's been incredibly beneficial for me personally. I know it's kind of a little bit of a unusual thing right now. I feel like in a few years it'll be more the norm for young people to have their whole genome sequenced. I know for me personally, over the last few months, it has become increasingly helpful for me as the physicians that are helping me work through some health stuff have been able to pull from that and kind of understand either what medicines for me would be best, or what particular diseases or just general medical issues that I would be more susceptible to based on medical history or maybe some different mutation. So for me personally, it's been extremely beneficial. And I know that there are lots of case studies, like the Bronny James case study with cardiovascular disease. I think that is one case study that's an example of a young person that has a medical affliction that could definitely benefit from precision medicine, whole genome sequencing, and moving forward in terms of like their healthcare and general practices. So yeah, I think it's going to be the norm, or at least I hope it's going to be in the next couple of years for young people.
Building off of that, I've had a lot of friends do like Ancestry.com or 23andMe, which is usually microarray data. I have not done either. I know there are privacy concerns that I think we'll get to later with getting your genome or DNA sequence, but I do think, as Eliana said, that preventative care, especially genome sequencing, is like the future of medicine. You can see just with Barney James, someone who's a high-performing athlete who you would never expect to have cardiovascular issues, who suffered from a cardiovascular challenge. And I think personalized medicine, especially preventative personalized medicine, is something that could definitely have not only benefited him as an athlete, but benefit all of us. We are young and healthy on the outside, but I think if take a deeper dive and get your genome sequenced to realize that maybe you are carrying some genes or mutations that can be harmful in the future, and it's just about taking care of the preventative steps now so that in the future you won't suffer like maybe other people have.
Yeah, the Bronny James example is a good one. And also, Taylor, do you remember Hank Gathers?
Of course I remember. I mean, okay, I didn't watch Hank Gathers play, but I mean, he was at our school over at LMU playing basketball. And actually, I had a friend that died from in a similar way when he was in high school. He was my teammate. So very similar.
So these guys that have sudden cardiac events while playing sports, it's usually, in an 18 or 20-year-old, it's not really cardiovascular disease so much because it's structural or a rhythm problem. So for Hank Gathers, he had a condition called hypertrophic cardiomyopathy, which can be predicted from genetic testing in many cases, and certainly could have led to, if it was determined that he was at increased risk, there's pretty simple screening things you can do in terms of echocardiograms, and if it needs to be taken further from there, what they call electrophysiology studies. I think with Bronny James, I don't think it's publicized exactly what went on with him, other than it was clearly some kind of arrhythmia, and it was suggested, at least in the press, that what they did release, that it was a congenital condition. So if it was a congenital condition, then likely it was associated with some kind of inherited risk. And again, as Lexie and Eliana are saying, it may have been helpful if there was whole genome sequencing done on him. And maybe in all kids, when they go to enter those years where they're going to be doing athletics, you could screen for gene variants that might lead to an arrhythmic event while they're playing, and screen appropriately for it and plan for it in advance.
Yeah, I was just going to say, is like, at what age would you really think that, I mean, would it be appropriate to get their whole genome sequenced then, like right when they're babies out the womb?
Yeah, no, so Robert Grain at Harvard, he's the head of genetics and genomics there, and he's leading something called the Baby Seq program. So anytime you see the letters SEQ associated with what we're in precision medicine or personalized medicine, it involves sequencing. So he is off trying to do a study where they're sequencing 1 million babies, at the time of birth. And I guess presumably looking at how useful that is over these, first few years of life. If a certain number of babies are born with inherited metabolic conditions that, maybe it's a recessive gene carried by both the parents, et cetera, you can get a big head start if something looks like it's going wrong. If you've had the baby sequenced at that point, and it would save days or weeks or months if you could use that information to help sort out what might be going on.
Yeah, that's really interesting because I feel like a lot of parents would be initially hesitant to do that because there's lots of discussion, especially around these microwave sequencers like 23andMe and Ancestry, about where does that data go? Like, yes, it's going to be beneficial for the patient, but is it stored in the cloud? Is it in an EHR? Does like a company like Epic have access to it? What does that look like for whole genome sequencing and the precision medicine industry as a whole?
Yeah, well, of course, the technology is ahead of the ethics and legal stuff. I can hit on a few of the high points. So from a federal level, there's something called the GINA, G-I-N-A, which is the Genetic Information Non-Discrimination Act. And basically, that piece of legislation says you can't use someone's genetic information to discriminate against them in terms of employment or housing, I think, or obtaining healthcare. You can use that information, though this is at a federal level, to discriminate in terms of life insurance or long-term care insurance. Now, in certain states, like in California, there's further legislation that says you can't use that information to discriminate for those purposes either. But you bring up another point of where is this information stored? How secure is it? Those are huge, huge issues for sure. And one other interesting thing, there is, of course, an international ban on doing gene editing and at the germline level. So a couple of terms I think we maybe talked about on the podcast before. So the germline is where you make changes in an embryo such that the eggs or sperm cells that the embryo winds up carrying and passing on after the embryo grows up into a human being and passes on to their children. There's an international ban on doing any kind of modifications that can be passed on to progeny, to children. But of course, there's also somatic, which means not germline editing that occurs in diseases like sickle cell that are positively life-saving, life-changing for the patient that gets them. So you may or may not be aware that in China a few years back, there was a scientist that did gene editing on his own kids' embryos. Have you guys heard about this?
No.
Is this the twins?
Yeah.
Yeah.
And so the edit he did involved a gene loosely related to the immune system. So I don't know if you guys have had this in biology yet, but you know how HIV gets into the T cells, which it infects, and it's through the CD4 protein on the cell surface. But there's actually a companion protein to the CD4 that also needs to be functioning in order for the HIV to bind the CD4 and be pulled in and infect the T cell. He did a gene edit on that companion protein to the CD4, theoretically to make his children immune from HIV. And in fact, the way that this particular protein was discovered, there was a family in Europe who were demonstrated to be absolutely immune to HIV. And they figured out that that was this little companion protein to the CD4 protein wasn't functioning right in that family. So they were immune to HIV. Does that make sense?
That does make sense. I think something, as we've been speaking about privacy and gene editing and who has access to your data, that is so great about Biography Health and our platform is that the platform was built from scratch and the data isn't going anywhere. It's just stored in our platform for your personal use. And I think that's extremely important. So your data is not being spread for gene editing to any EHRs, to any it's not being outsourced, and you're not selling it anywhere, and we're not selling it without your permission. I think that is really important to me, and a big reason why I haven't done 23andMe or Ancestry or any of the other companies, because I don't know where my data is going, and to know that this platform is built from scratch and that the data is safe and protected is something that is really a big factor as to why I chose to get sequenced and want to get sequenced through Biography Health. And I also think it's important to our generation, especially as we are learning about privacy rights.
Is that a pretty common interest for like Gen Z and the younger generation is with like privacy? Because I'm not gonna lie, like when I was 19, 20, 21, 22, like I really didn't think about that in any way, shape, or form. Like, is that now a common theme and trend that you see with your peers of caring about it?
Yeah, I would definitely say for sure. I mean, I think it's been normalized to the point where like you're colloquially talking to someone and then Instagram hears something, you're like, oh my gosh, that just popped up on my recommended, like they're listening. Or like the Alexa thing and the Amazon Echo, like people panicking over that. I think a lot of people have superficial concerns about privacy and data collection. Not a lot of people have taken steps in order to protect their data. Like everyone just kind of knows it's there. No one really reads the terms and conditions. Unless you do, then props to you. You must have a lot of time on your hands. But I mean, I think it's an issue that people that are in the tech space and also in the healthcare space are becoming increasingly concerned about, especially with this almost a monopoly that a lot of the tech and big biotech companies have in their respective arenas. They're using data and they're using these so-called these privacy concerns, like these personal information, in order to build their monopoly and contribute to the network effect. So I think it's a problem now. It's going to be an even bigger problem next year and an even bigger problem the year after. And legislation is 10 years behind, is going to keep trying to catch up. But I think each person is going to increasingly take more autonomy over their data and privacy rights. I hope.
I agree. I think it's as simple as like every website has a cookies option, and if you're allowing them to use or sell your data, I think people are concerned that personal health data will be leaked and shared to places that they're not familiar with or aware of. And I think especially when it comes to not just lab data, but your specific gene mutations, it's very personal, and that's something that I know, especially I want to know that I have control over who sees it and where it's going. So I think being able to see it on my dashboard and knowing that that's the only place it'll be other than shared with physicians who I choose to share it with or Dr. Stanford was super great and a great benefit to using a platform that's not like outsourced by several doctors or clinics, and that like we have personal relationship either with Dr. Stanford or with the physician who's doing the like intake forms, rather than I feel like 23andMe is advertised everywhere and you don't know where it's being used and who's using it.
Yeah, this is bringing up very fascinating points that I never really considered, because I remember when I was telling a very close family member that I was going to be going over my health information on a podcast. Yeah. Like he freaked out, but like for me, I mean, of course it was just like a matter of just sharing it and trying to be as transparent as possible. But one of the points that they brought up was the part of discrimination in case, let's say, a future employer wants to look at it and is like, oh, this guy might die in like his 50s or something like that, and that can be used against it. But this is the first time I've heard about Gina being put in place like that, and it's cool to hear that. It sounds like we're almost trying to take a step in the right direction to help protect that data and protect that privacy. But I can also see the magnitude of this problem really becoming pretty large, considering AI and all of the million data points that have to go into being able to make these predictions and recommendations for somebody's healthcare strategy.
Yes, I agree. Speaking on AI, that's something that I worked a lot on this summer, and how to use artificial intelligence effectively, but also while following HIPAA and protecting data. And I think, especially within our app, your data is fully protected. None of your personal information is put into any AI, like large language model. I think that's super important, is that we were able to extract the important pieces of data without any personal identification. And that allows us to be able to make the best recommendations possible, but without putting you at risk. So I think that's something pretty incredible, and not something that other companies are offering.
Yeah, that's a great point. And just for the time being, patients always ask me, is this something I should give to my doctor to upload into my healthcare system, medical record? And I generally discourage that. I just think there's just, too many unknowns for that right at the moment. I would just tend not to put my VCF file, so to speak, every genetic variation that you have. I wouldn't make that available. You never know how that's going to get hacked and used in a way that's not in your favor. So like Lexie said, it's important that whatever company you're doing are working with is taking every step to protect it. First, to de-identify that data and keep it protected.
Dr. Stanford, I'm going to have you put on a Papa Stanford hat this time in speaking in the perspective of a parent. Then let's say that somebody of the younger generation does want to get genetic testing done, and they have to, let's say, talk with their parents and how and why they should get it. But the parents just have this very traditional way of thinking of like, oh, you're so young, you shouldn't have to worry about this. Why are you thinking about it this way? How would you tell them to have sort of that conversation? Not necessarily to convince or persuade, but to be able to try and, I guess, educate the parents instead.
Well, I think that one of the perceptions out there I've seen is that you wouldn't want to know about things that you can't do anything about. And so that's just, in this day and age, there's just very little that falls into that category. So almost virtually everything that could be predicted based on your genetic profile in terms of your potential risk downstream for certain diseases, it's rarely 100% that this is going to happen to you, and it's rarely 0%. So what you're obtaining with going through a process where you get sequenced and then that data is analyzed to predict your future risk, almost anything you can think of, there are things you can do to mitigate that risk. There's coronary artery disease, cancer. If you're at increased risk for cancer, there's going to be certain do's and don'ts. You're not going to want to smoke. You're going to try to avoid obesity. You're going to try to keep your blood sugars in check. You're going to try to have a high level of physical fitness, et cetera. You're going to, and you might counter that and say, well, everybody should be doing those things. Well, that's true. But then there's other things like screening that you can do. One of the key things here, and what the present day and the near term and far term future is, the sooner you know about your transition from health to maybe you're starting to develop this disease, fill in the blank, coronary artery disease, cancer. The earlier you know, the higher the probability is you can reverse it or stop it so that it doesn't affect your overall healthcare trajectory. So you want to be very vigilant on, especially for those things you're at higher risk for, and you want to catch it. You want to take steps to prevent it from transitioning from health to disease, or you want to catch it at the earliest possible time where it's easier to deal with. And that's true for all the major categories of disease. You talk about, the four major categories of cardiovascular or vascular disease, atherosclerosis, cancer, neurodegenerative diseases, and metabolic diseases like diabetes. The sooner to know that you're at increased risk is very useful. I think that with the older generation, there may still be this perception that there's really not that much you can do, that you're really kind of a leaf on the wind, and whatever is going to be is going to be. But that is not at all reflects the reality of the biology and the pathophysiology of how diseases occur. Every day that goes by, we know more and more about how to prevent, more and more about how to address early on and reverse the disease process.
Early on enough, even in the 19s and 20s and 21s and 22s.
Yeah, because most of these chronic diseases, so usually when I think I've had this conversation with both Lexie and Eliana, is that the best way to live longer is not to die prematurely of something preventable. The best way to have a longer health span where you're functional into your 80s and 90s is to not let those debilitating chronic conditions develop that would impact the quality of your life as you're in your 70s and 80s. Most people of our parents' age or my age, often the last 10, 15, 20 years of their life is not nearly what it could be because they're they're debilitated by chronic disease. So the idea is to postpone that as long as possible and prevent it if possible. And if it starts to occur, take steps to address it just as it's starting to occur when it's most easily dealt with. So in playing this game, and let's gamify it, that you want to have the very longest health span, the runway, so to speak, the onset of these chronic diseases, most of them, for example, atherosclerotic cardiovascular disease starts in the teens and 20s. We've talked about that. So you would want to know you were at risk for that. And preventive cardiologists are saying now, yeah, if you're at risk and you've identified yourself at risk, you would probably want to take steps to slow progression now so that you're in a much better situation, 40, 50 years from now. And the same with cancer, same with neurodegenerative disease. These diseases have long runways. You would want to know that you're at risk as soon as possible so you can develop the kind of lifestyle that's going to minimize the chance you're ever affected by those chronic diseases.
So since Eliana and Lexie, since you've known Dr. Stanford and of course your parents for quite some time now, was there a specific conversation or event or experience that really flipped the switch for y'all to then have this mindset towards preventive care?
Yeah. I mean, I think a lot of case studies can testify that preventative care is the way of the future and should be the way of the future. I mean, I know just from patients of my dad's interacting with me personally and saying, oh, your dad saved my life by reviewing my chart in this way, by being detail-oriented, by taking a detailed family history and really taking the time to understand not only what my biology is, but what my background is contextually, that made the difference in life or death. So that is really what sold me on precision medicine and preventative care. Is it is just that extra step, that extra not only empathy, but genuine desire to understand someone's lifestyle, family history that can really elevate care and really do some incredible things. So that's what personally got me on.
Earlier in the podcast, I mentioned the breast cancer and my family and knowing that that could be preventable, or that I could understand if I do carry that mutation, and if so, or that gene, and what I should do to, in that case, especially like when I should start screenings, I think was really important. I also think my parents both got their pharmacogenetics done, which is like they were able to tell specifically like which medicines they respond better to. And I think something that came out of that was that there are a lot of gene mutations in my family for like anxiety and depression that relate to serotonin and dopamine and norepinephrine and all of these chemicals that do relate to mental health. And as someone who does have anxiety, I was able to decide which medications to take based off of what genes I knew that my parents carried to probably transmit to me. So I think that was great, was to be able to realize that like things that have been passed on to me, and then therefore which medications they may respond better to because of my like body composition and gene makeup. And that's not something that we had 15, 20 years ago. And so now being able to do that, I think that's great. And I was able to pass that information on to, let's say, my brother or my younger cousins or other people in my family who also are on like serotonin reuptake inhibitors, and which ones work best for maybe people in our family who have carried that genetic mutation.
Yeah, and I think that's something that's not really discussed about enough. Well, I mean, the topic of anxiety and depression, I mean, I feel like it's becoming a lot more common, especially just in this social media age and access to absolutely everybody at any given time, to be able to compare yourself to Kim Kardashian or some famous celebrity that's like our age. I didn't think through just some of those implications of how my body reacts to certain drugs or medications, as specifically to anxiety and depression, with the rise of just like how fast it's going and whatnot. And so I think that brings another great point that I feel like is now starting to become more appropriate in our conversations, especially just in healthcare in general. I mean, I don't know if y'all have heard this, but I mean, my parents, or no, not just my parents, but just like the older generation is like, oh, just suck it up. But it's cool to see that it's just starting to become more comfortable to talk about and even address moving forward, and even just how precision medicine can really just help alleviate some of the anxiety and depression and work towards like a solution of how to manage it.
I agree. I think it's great that precision medicine isn't only just helping physical health, but also mental health, because a lot of people's mental health is related to lack of chemicals in their brain or chemical imbalances. And I think it's not just like all of the stimulation we're getting from social media or outside. And so to be able to have that information about what's actually my chemical imbalances and gene mutations or differences, what's actually going on in my body, has made a really big impact on me personally. And I know a lot of people who've also had the same sequencing done, and it's made a lot of impact on them. And they're also teens and Gen Z.
Yeah, and I was going to mention with pharmacogenomics, and basically we're all different, right? And so we have different rates of metabolism based on our genetic makeup for some of these medications, and definitely a different risk profile and a different efficacy profile. So back in the good old days, we used to just have to try different drugs. Is this helping? It's not. Is this the right dose? Maybe we need to increase it. Maybe we need to decrease it. And it was a pretty random process, actually, to a certain degree. Now you're able to make more, as the provider, the healthcare provider, you're able to make more informed decisions about what's likely going to work. And so there's less of these iterations, and the person can get help there. I think and especially in the mental health world, the application of pharmacogenomics it's been one of the very first use cases is in the area of mental health medications and whatnot. But it does apply to other medications treating other diseases as well.
Throwing you on the spot here, Dr. Stanford, but just off the top of your head, are there any specific genes that you can see the prediction of increased risk for depression or anxiety of that nature?
Yeah, there are. Get into a little bit of storytelling. When I was first considering going into medicine, I thought neurology and psychiatry would be one of the most interesting things to get into. But I have to tell you that 40 years ago, the brain was still quite a bit of a black box. In these days, there is so much more known about the underpinnings of mental health, where things are going wrong, et cetera. But I think that neuroscience and neurology and psychiatry and mental health is really going to benefit from the use of AI, the advent of AI. And, we've had this similar conversations about cancers and whatnot, where the pathways and resistant pathways and what makes a cell turn malignant. There's all these, very complex pathways, and no human being could ever figure it out. But if they can if a AI can figure out every possible move in the game, Go or chess or whatever, you can see that being able to solve these really complex problems, how that's going to lend itself to mental health. And I think you're going to see a lot more progress in that area, just leveraging AI along with genetics and other tools of precision medicine. So I think neuroscience and mental health and psychiatry, neurology is going to be the place, a really fascinating next 10, 15, 20 years in those fields. Well, I saw in your outline something about the democratizing, access to personalized medicine. And I think that's a good topic to get into. One of the questions might be that with whole genome sequencing, insurance doesn't cover it. And to restate it, and again, this is a reiteration of what's been said on other podcasts, the current healthcare system is not really set up well to be proactive. It's hard to get reimbursement for anything unless some event has already occurred. And, for example, if you wanted to get a test to see if you have extensive heart disease and or the beginnings of heart disease and you're 30, you're not going to be able to get that test paid for by insurance. They want you to have had a heart attack or some evidence that something bad has happened or is imminent, like you have cardiac chest pain. What that doesn't appreciate or recognize, though, is we're changing the paradigm where we are trying to make sure those things never happen, or they don't happen for 40, 50, 60 years from now. In order to most effectively do that, you need to start assessing risk and looking and screening at a much earlier age. So, I guess we can't screen the whole planet for coronary artery disease at age 30, but we can get smart about it and identify those that are at higher risk, that you can predict are at higher risk based on their genetics, their current blood tests, lipid profiles, et cetera, and decide who would benefit from more aggressive screening. So, and I think that ultimately, I think right now that value proposition is already there. And it's yet to be made in a randomized controlled prospective, trial type manner. But the value proposition is there because the cost of these diseases is so high, down the road, that it's not, that provides a lot of resources saved down the road could be applied earlier to make sure that those resources down the road never get consumed, so to speak. And as this gets demonstrated, the paradigm will shift to be predictive and proactive and preventive.
I think something that I've been thinking about as I'm going to college is we have to opt into insurance plans and decide what our insurance should be. And as a child, I don't really think I learned about what insurance covers and what insurance doesn't cover. And now being in college on my own, learning, how healthcare is accessible, where insurance covers, and what insurance covers has been really important to me, just so I know kind of how the system works. And through going to college and learning about the insurance system, and I hear it with my peers too, when like they need to go get labs drawn or go to the doctor. Now that we're older and we have our own medical insurance, it's a different perspective. And so, like Dr. Stanford said, this isn't covered by insurance. And I think it's important to understand why whole genome sequencing, one, should be covered by insurance, but it's not. And then, therefore, like the reasons why you should pay for it and why it is important. We are young and healthy, but it is preventative. And I think making it accessible to everyone is something that this company is really trying to do and make sure that it's at an affordable price point, which, especially the younger generation, is super important. So I think that is also another reason why 23andMe and Ancestry.com get a lot of attention, is because they are at lower price points. And I think being able to get whole genome sequencing or comprehensive microarray through Biography Health or through another company at a lower price point, especially since it's not covered through insurance, is really important.
Yeah, I mean, people make lots of investments for their future. It's kind of crazy to me that healthcare is one of those things that people are like, oh, whoa, why am I spending that money? When like you see someone driving like a very expensive car, but they're very hesitant to invest in their own automobile machine that they're walking around in. I don't know. I think obviously it's going to be a slow burn in terms of changing people's minds about healthcare being a worthy investment, but it is the most obvious thing to anyone, but it's the thing that is the hardest to actually have sink in, which I think is really ironic. But like Lexie and I have been saying, it's really exciting because we see this kind of gradual shift in our generation towards health and wellness and understanding supplements and understanding sleep and trying to maximize your health through behavior. But I think this added element of precision health and preventative care is going to be perfect for our generation now and going forward, and that we can add this biological element to it to really support this like health and wellness journey that a lot of people our age are embarking on. So although right now I think there's a lot of weird, but whatever, pushback in about healthcare, hopefully Gen Z is that kind of transition period where people start actually taking healthcare seriously and taking their own health and wellness into their own hands and the hands of their primary care physician. So
yeah, and it's also kind of interesting too, just to think about like when we talk about that pushback, it's almost ingrained to us as a system that dictates what we want to do with our career. I mean, I hear it all the time from my parents and aunties and uncles saying, "Oh, make sure you have a job that has benefits where they could have your health insurance cover it," but they're not going to be able to cover, of course, the whole genome sequencing at this time. I mean, of course, there's going to be that shift at some point in time. But it is crazy to think about how our healthcare is sort of like dictated by just what jobs we want to pursue based on the benefits that we can get.
Yeah, that's kind of crazy. I don't know. I mean, it's I don't know long term, again, 10, 15 years from now. I don't know that the current model where your insurance is tied to your work and that it's on this, break and fix kind of paradigm. I don't know how long that's going to last. And it's probably a topic for another show, but I don't quite see commercial insurance surviving too much longer. And when I say too much longer, I don't mean a month or a year, but I mean 10, 20, 30 years from now. I can't imagine that health insurance through your employer and continuing and the mode that it's in is really going to survive. So, one thing I did want to bring up, speaking of insurance and different healthcare delivery paradigms. So the these Gen Zers, I think that the two I'm looking at right now are probably more well traveled than even I am, and so they tend to have a bit of a global view. And of course, they're, to generalize you guys, but I mean, everyone's concerned with a certain degree of equity, but it's easy to see that in third world countries, there's not a lot of equity when it comes to healthcare. The interesting thing about personalized and precision medicine is that it's very possible and maybe even likely that places where there is a struggle to bring a high level of quality healthcare to a population is going to really benefit from personalized precision medicine. So if you're not encumbered by some of the things we're talking about, which is a healthcare system that is reactive and based on insurance reimbursement and tied to employment and all these other complicating things. Let's say you just go into an African country, like I know Lexie was in Africa. I think it was Rwanda. I got to meet the Minister of Health for Rwanda, and she was all about it, all about personalized precision medicine. I met her at a conference, and really what personalized precision medicine might be able to bring to those developing countries is the ability to leapfrog. So, and I know, Eliana, you've been to China, but what you may not know is that China used to be entirely cash based. They never really had the check writing thing. They never had the credit card thing. They basically went from cash to WeChat, to where it's, virtual money. They just skipped the whole bank, credit card, check writing thing. And so I'm optimistic that developing countries, and just, I wish I could remember this lady's name, in developing countries, there's a possibility, especially as these technologies mature and get cheaper and cheaper and cheaper, that they're just going to, as they set up a modern healthcare system in these developing countries, they just go straight to what is most wise at this point in time, which I think is being preventive rather than reactive. And so sequence the population, have you ever heard this statistic that there's more cell phones in Africa than people? So I don't know that the truth of this is probably an exaggeration, but even those nomadic type tribes, they all have cell phones. Do you know about this?
No, but I am curious how you found out about this.
Yeah,
because it's just that, and just like you all, definitely as someone that is something of a pioneer in the field, which I'm going to say that I'm one of the many. You think about these things about, do we really want to just create a society where only rich people have access to these tools, right? So it's how do you scale this? How do you, is there a possibility to bring this to people that you wouldn't think would ever have the opportunity to do it? So it turns out it probably is doable to go from that direction rather than build a bunch of clinics to take care of people that have heart attacks. Why wouldn't you just go get a saliva sample from everyone and figure out what their risk is and then target them directly with specific screening or interventions to prevent, to preempt the need for large hospitals to take care of people with diabetes and amputations and heart attacks and advanced cancers and all that. So you can see that there's a certain advantage to starting with a blank slate. So if you have a kind of a global view, like I know that the Gen Z have, and I admire that about them, you can see that there's real potential for this to bring high quality healthcare to developing countries.
I think a great point building off of what you said is that it's very scalable because we're doing precision medicine. It's in a box, literally. And so it's easy to take to remote places or college campuses, to large groups, to small groups. I think that's something to point out that you don't have to go into a doctor's office. You literally need to spit into a tube. And I think that is, and send it in the mail. I think that's something that's super important, is that you can, prioritize your health and your wellness from wherever you are. And that's not something that maybe we've seen as much in the past with healthcare, where it's been traditional, doctor's office setting, or now telehealth. So I think it's great that we're able to kind of move with the times and be able to speed up our healthcare system and to make it more accessible to everyone, regardless of where you are.
Yeah, and modernize it. So instead of living with the situation as it is and the system as it is, think about what it could be and what it takes to get there. And, we're sitting here on this Zoom, and it makes me think about telehealth, for example. So telehealth, in 2019, you couldn't do telehealth. You're not going to be reimbursed for any healthcare you give over the phone or, over a video chat. Yeah, overnight that changed.
Forced to change.
Forced to modernize. And I think that this modernization and getting up to speed is leveraging the science of today. The problem, or I don't even know if it's, I don't know that there's any big conspiracy out there, but let's suffice to say that there are stakeholders out there that are doing very well. 20% of our GDP is being spent on healthcare. And I think that what's the GDP is like 20 trillion. So you're talking like $6 trillion, or 20% of, or 20%, 20, yeah, like $3 to $4 trillion spent on healthcare every year. And people that are doing well in the system, they don't want to see it change. So, there's definitely inertia against it. But, notwithstanding that, there is just, in the way that things are set up from a regulatory standpoint, most of us that trained in, I don't speak for Lexie's mom and dad and myself, I know that we're all trained that in order to adopt a new approach, it has to have gone through certain steps. So ultimately what happens is that something we know is helpful right now. We know that it's likely helpful based on preliminary studies, et cetera. The time it takes for that to make its way into a guideline or standard of care is estimated to be 17 years. Well, in the world you guys are living in 17 years, the world will not, in the most remote way, resemble what it was 17 years previous. And so approaches we take based on the approaches we're taking now in the year 2025 were developed, around the year 2005, 2010. And the science has changed so dramatically since then. So for example, in 2010, you couldn't just go out and think you're going to do whole genome sequencing on someone. It would cost hundreds of thousands of dollars and take months to do. The human genome was just sequenced for the first time 21 years ago. So you can see the problem here is that the technology is advancing way faster than the current paradigms around vetting treatments or vetting approaches. So the regulators out there, the FDA and the Center for Medicare, Medicaid, the CLIA people that decide how to regulate this need to, and they recognize this, they need to completely change their approach. And even that is going to take years and years. So, it's going to be interesting, but we're going to be operating for quite a while here where we know something, a particular test or particular medication may be helpful, and yet, guidelines are not going to call for it. So for a while, medicine is still going to be the art of medicine and the practice of medicine. And, the new doctors are going to have to look at what is going on with their patient, what tools are available, and make decisions about what's most likely in the best interest of their patient and in terms of best chance at a benefit and the least chance of harm. And there's not always going to be guidelines to go by, just because of how long it takes to develop those pathways and how quickly the science is moving.
Well, considering the future, how quick the science is moving, and just the different landscape that we're going to be 17 years, 20 years down the line, I have comfort that we have pioneers like Eliana and Lexie to be able to have these conversations, come on a podcast and talk with us. And so I just want to say thank you, Eliana and Lexie, for joining us on this podcast. It's great having y'all here, and I can't wait to see what more y'all accomplish, and even invite you back for another conversation after. I know. Oh. Eliana,
I'm honored. Yeah. I'm honored to be here.
And the world they're going to be working in 20 years, 20, 30 years as providers and scientists and whatever they wind up going into, if you were to describe that world right now, and it sounds like it sounds like science fiction, it probably is science fiction, but if you to find that world 20 or 30 years from now and it doesn't sound like science fiction, it's not going to be accurate. We can't imagine what the world is going to be like from a scientific and medical standpoint 20 or 30 years from now, beyond anything anyone can conceive. You better be ready to move fast, learn, unlearn, and relearn. That's the mantra, and that's the science is going to demand that out of doctors of the future.
Thanks for joining us on the Precision Medicine Made Simple podcast. If this episode inspired you to learn more about your health, please leave us a review and share the podcast with a friend. Your feedback helps spread the word about the power of precision medicine. Remember, taking action today can lead to a healthier tomorrow. See you next time.